So you're basically one distracted click away from, well, a major dosing error or a HIPAA violation.
Yeah,
And
exactly.
at the same time, you're doing the work in three people. The burnout is just, it's real.
Yeah.
So here's the contradiction we're looking at today. Can this technology we're told to fear, artificial intelligence, actually be the thing that saves your sanity?
It's definitely a tension that every pharmacist is feeling right now. We're diving into this pharmacist study guide today, looking at AI-assisted practice with Perplexity. And the guiding principle here isn't just efficiency, it's prudence.
Right, right.
Like the old school definition of prudence, right reason in action. It's really about being the human in the loop.
Okay, let's unpack this. You're at a busy counter, the phone is ringing, and you need to explain a complex blood thinner. The guide calls AI a helpful intern. But wait, I've worked with intern.
We all have, yeah.
Right, and they're great, but they also make mistakes that can get a license revoked. So why would I bring a, hallucinating AI intern into a high-pressure pharmacy?
Well, you're totally right to be skeptical. That's exactly why you never treat it as the final authority. The guide introduces this safe AI use sequence. It's ask, review, verify, and apply. Think of the AI as this really fast, helpful intern who's great at drafting, but never has the final word on clinical dosing or high-risk meds like anticoagulants.
So it's absolutely not a substitute for Lexicomp or Micromedics or the FDA labeling.
Oh, definitely not. Not at all.
It kind of reminds me of using a GPS that occasionally suggests driving straight into a lake. It's super helpful, but you still have to look out the windshield, right?
That is a perfect analogy. What's really fascinating here is that the tool is best used for orientation. So instead of you manually scanning a dense 50-page package insert, it acts like a context-aware search.
Oh, I see.
Yeah, it points you to the exact section you need to focus on first, but then you still have to verify that finding.
Right, so you're offloading the search labor, but not the actual judgment labor.
Yeah.
But if I'm going to talk to this thing, I have to know how to steer it.
Exactly.
And the guide breaks down the anatomy of a perfect prompt into 4 pillars: role, task, context, and constraints. But wait, why can't I just ask it a straight question?
Well, because AI is basically a probability engine. If you just toss it a generic question, it gives you the most probable, jargon-heavy medical text it was trained on. You have to tailor it.
Like specifying if you're writing a stepwise operational thing for a technician versus something clinically concise for a prescriber.
Precisely. And that's where iterative prompting comes in. It's a conversation, not a one-step event. You add constraints, like telling it to write at a 6th grade reading level.
Okay, wait, I have to push back there.
Yeah.
Does adding constraints like a 6th grade reading level actually make the pharmacist more effective? Because my patients are smart, they just aren't doctors. Isn't it kind of patronizing?
I get why you'd think that, but it's not about talking down to them at all. It's really about cognitive load. When a patient is starting a scary new therapy, they're overwhelmed.
Right, they're just trying to process the diagnosis.
Exactly. So the AI helps you strip away that clinical density. Instead of saying adverse GI effects, the AI suggests saying, this might upset your stomach. It helps you find those patient-friendly words when you're just too tired to be empathetic.
Wow. Yeah, I feel that. It's really hard to be warm when you've been on your feet for 10 hours.
Yeah.
So you could use it to draft teach-back questions.
Yes. Or even non-judgmental adherence scripts, like for patients who missed a dose so you avoid shaming them.
That is huge. Turning a refill too soon call from a confrontation into an actual conversation.
Yeah.
And the guide mentions using it for planned dose Zodiac cycles too, right?
Right, those PDSA quality improvement cycles. You can use the AI to draft standard operating procedures to fix workflow bottlenecks.
But this raises an important question for me. If we look at the bigger picture, how do we make sure we aren't just reducing patients to efficiency problems? Can an AI really capture the dignity and autonomy required for morally sensitive therapies?
That's the core ethical tension. AI handles the structure, but you bring the empathy. And speaking of ethics, we absolutely have to talk about the privacy hardline.
Yes, de-identification. I've heard horror stories about people putting protected health information, like PHI, right into these tools.
It is the absolute golden rule. Never input PHI. No names, no dates of birth, no medical record numbers.
So how do you use it then to solve workflow issues without breaking the law?
You rely on generic scenarios. You use the AI to build the tool, not to process the data.
Oh, like designing a spreadsheet structure.
Exactly. Say you need a tracker for vaccine inventory or clinical interventions. You ask the AI to design the table logic without ever touching sensitive data. You use the AI to build the bucket, but you keep the water at home.
That makes perfect sense.
Yeah.
Because if we connect this to the bigger picture, accountability always remains human. The AI doesn't have a pharmacy license? I mean, you do.
Precisely. Accountability is entirely on you.
Which is why building a personal prompt library is so helpful to just standardize your daily tasks safely.
Yeah, and it brings us back to that pharmacy trivia from the guide, prudence being the virtue of right reason in action. As AI gets faster, the pharmacist's role is shifting. We're moving from being a fountain of facts to being the guardian of context.
Guardian of context, I really like that. So here's a closing challenge for you listening. Today, try drafting one 6th grade level counseling script for a super common medication like metformin just to see how the AI reframes your expertise.
And as you do, think about this. As AI gets faster and more capable, what is the one thing only you can provide to the person standing across the counter?
Food for thought. Maybe the most prudent thing we could do is use the tech to buy ourselves the time to actually be human. Thanks for exploring this with us.
Good morning. We're just coming in to review your medications.
Everything looks in order based on your chart.